Are you really caring your children enough to avoid teen violence? Now let's see what is teen violence. Teen violence refers to harmful behavior that can start early and continue into young adulthood. The young person can be a victim, an offender, or a witness to the violence. Some violent acts can cause more emotional harm than physical harm, others can lead to serious injury or even death. The violent acts can include bullying, fighting, including punching, hitting or slapping. Teen violence has many risk factors. The most important one is the behavior of their friends and classmates. So the parents should know about their kids that with whom they hang out, and encourage them healthy behavior and relationships. Risk factors for violence are not static. Their predictive value changes depending on when they occur in a young person's development, in what social context and under what circumstance. Certain factors may increase teens' risk of experiencing and perpetrating teen dating violence. A number of studies have looked at the relationship between teen dating violence and community, family, peer and individual risk factors. There are other most important risk factors that leads to violence in youth. Let's check it out. They are individual, educational, community, family, and social risk factors. Now let's go through individual risk factors. A risk factor is any attribute, characteristic or exposure of an individual that increases the likelihood of developing a disease or injury. Examples for individual risk factor are underweight, unsafe sex, high blood pressure, tobacco and alcohol consumption, unsafe water and hygiene. Teens with low IQ, cognitive deficit or learning disorders are most likely to behave violently. Attention deficit and hyperactivity are also risk factors. A history of abuse and aggressive behavior increases a teen's risk of behaving violently. Antisocial beliefs and involvement in illegal activities such as drugs and alcohol addiction also becomes teen violence. Emotional distress play a role in violent behavior. Now let's see educational risk factors. Education risk factors are characteristics of the children or their families or environments, which makes it more likely that a bad outcome will occur. Poverty is a major risk factor for poor educational outcomes. College and school environment are an important educational risk factor which influences certain youth violence conditions. School departments who report gang and drug activity have higher rates of violence. Teens who dropped out of school prior at the age of 15 are more likely to commit acts of violence. The student's poor performance during elementary schooling will also increase the chances of violent behavior. Now, community risk factors. The community risk factors are those elements in a young person's environment that increases the likelihood of them engaging in health-compromising behavior. Adolescent exposure to violence amplify the concept of community violence. Teens may witness the violence in their neighborhood, or they could be a victim of the violent acts. We will now go through family risk factors. Lack of emotional attachment to parents or caregiver increases the likelihood of developing a mentality that causes violence. Childhood abuse and neglect also increases the chances of violence in teen. Lack of supervision also give teen opportunities to join gangs, use drugs and engage them in antisocial behavior. Stressful family environments such as lack of parental role modeling and inappropriate behavior contribute to a teen's sense of worthlessness and conflict in the home. Now let's see social risk factors. When teens have easy access to weapons, they are more likely to engage in violent acts. Associating with delinquent peers can lead to increase in the violent behaviors, and also pushes teens to involve in illegal and violent activities. Low involvement in structural activity like clubs or sports. Is youth violence preventable or not? Let's see now. Yes. Violence or risk factors can be preventable. Follow these steps. 1. Settle arguments with words, not fists or weapons. 2. Do not use alcohol and other drugs, and stay away from places and people associated with them. 3. Help younger children to avoid being crime victims, set a good example and volunteer to help with community efforts to stop crimes. 4. The main aim should be to prevent the possible violence before it occurs. 5. Focus more on immediate responses to violence, such as pre-hospital care, emergency services, and treating sexually transmitted diseases following rape. 6. Long-term care in the wake of violence such as rehabilitation and reintegration, and attempts to reduce the long-term disability associated with violence. Spend quality time with children, listen to them like a friend. Then only they will listen to you and respect your words. First give them what you want in return from them. For more health and fitness tips and news, follow curexp.com on Facebook. Also subscribe to our YouTube channel.